Mental illness can go unrecognized for many people, by your friends, family, and even yourself. And with a surge in declining well-being for kids nationwide, in today's Wellness Wednesday, we're addressing how you can recognize mental health disorders in your child. And joining me this morning to discuss this is Dr. Lauren Baker with Mayo Clinic Health System. Thank you so much for joining me this morning.
Good morning. Nice to see you.
So, what are the signs to look for in your child that could be a mental illness?
So the biggest things that I look for when I'm meeting with families are going to be a change in their usual interaction and function. So things like declining grades in school or engagement in school, not doing the things that they used to be involved in. So if someone used to be, active with friends or in different activities and they're kind of dropping off of those would be signs to ask a few more questions about how they're doing. The most common things that we see are anxiety and depression, and definitely with changes over the course of the pandemic and with schools going back and forth, we are seeing quite a bit of that.
And it's not an easy topic to discuss with your child. I'm sure it's hard to get them to talk about it too if it's new for everyone involved. So what is the best way to approach it?
I would say starting with what you're seeing. So just saying, I noticed that you seem down a lot more, or you're not doing some of the things that you used to do. Maybe you notice they're a little bit more irritable than usual. I'm kind of just saying, are you seeing that? Do you want to work on that? I think is a good place to start.
Yeah, just kind of having that open conversation, making everyone feel comfortable with what's going on. So what are some of the best resources, locally or available online that parents and children new to this topic can access?
So I highly recommend, as far as online or kind of community resources that are available across the country, the National Alliance for Mental Illness, NAMI, has a lot of great resources for kids and adults who might be concerned they're having some mental health symptoms. I also think that meeting with a primary care provider, pediatrician, depending on the age of the person, is a good place to start, especially if there's someone who knows your child well, because they can help sort out what the difference might be between just kind of an age-appropriate change or situational change versus something that might be considered more of a disorder.
Definitely, that is some great information to know. Thank you so much for joining us.
Absolutely.
And now we'll send it to break.